not everything that happens in intimacy is safe for your health. Some practices can bring risks that few are aware of, but these risks can have serious consequences for both you and your partner. Anal S3X requires specific care because the anatomy of this region is very different from what many people imagine. I am Elena Rossi, Urologist, and in this video I will explain how certain behaviours can endanger both your health and your partner's. More importantly, I will show you how to avoid these problems, S, and ensure that intimacy remains safe and pleasurable for both of you before continuing. Check if you're already subscribed to the channel to follow our videos with tips on health and sexual education. If you're enjoying the content, like the video, it helps us reach more people. Leave a 1 in the comments if you found this topic relevant, or a 0. Otherwise, so we can bring you content that better meets your expectations. Anal S3X is a practice present in many relationships, both heterosexual and bisexual. While it is something that many explore, it is essential to understand the precautions involved, since this area of the body has unique characteristics that require special attention before detailing the possible risks. It's worth understanding a bit more about how this region works. The anus is the final part of the digestive tract, responsible for expelling the body's waste. The rectum, located just above it, is the last section of the large intestine. While these structures are essential for the excretory system, they are not designed to withstand the type of friction that occurs during S3X. Unlike the vagina, which has natural lubrication and elastic walls that can handle penetration, the anus and rectum have a more delicate mucosa, making them vulnerable to minor injuries. Because of this sensitivity, practices involving this area can lead to abrasions, cuts, or even lacerations. Furthermore, the fragility of the rectal lining increases the risk of sexually transmitted infection and other complications compared to vaginal penetration. The vagina, on the other hand, is biologically adapted for penetration. Its thicker walls and natural lubrication make the act safer and more functional, especially considering its role in reproduction. These differences highlight the importance of specific care depending on the chosen sexual practice to help you achieve a more fulfilling and harmonious S3X life. I've prepared the digital book, Rediscovering Intimacy, Healthy Sexuality After 60. In this material, you'll find practical and useful tips to strengthen your relationship, overcome emotional and physical challenges, and rekindle passion and connection in your marriage. Check the pinned comment to secure your copy and take this opportunity to transform your love and emotional life. From here, we will analyse the 5 main risks associated with anal S3X. First risk, more frequent injuries. This region of the body is not designed to handle the type of friction caused by penetration, unlike the vagina, which has a structure adapted for this purpose. The anus does not produce natural lubrication, and the rectum has a delicate lining that cannot withstand significant pressure. The result? Small cuts, irritations, or even more serious lacerations that can cause pain and bleeding, turning what should be a moment of pleasure into one of discomfort. To illustrate, imagine a thin piece of paper trying to support something heavy naturally. It won't have the same resistance as elastic tissue designed to handle impact. That's why those who practice anal S3X need to be aware of these natural limitations and take proper precautions, such as using lubricants and being more careful with movements. Taking care of your health is just as important as the moment of intimacy itself. This anatomical fragility highlights the need for extra caution to avoid discomfort and complications. It's not about creating alarm, but understanding how the body works and respecting its limit without necessary care. The experience can easily stop being enjoyable. Second risk, greater exposure to sexually transmitted infections. The structure of the rectum and anus being more delicate and prone to small injuries creates ideal conditions for the entry of infectious agents. such as HIV, syphilis, hepatitis B and C, herpes, and HPV. These infections find the rectal mucosa a vulnerable environment, especially when microtraumas or lacerations occur during the practice. Imagine this scenario: a small breach in an already fragile wall makes it easier for harmful substances to penetrate in anal S3X. The rectal mucosa is highly vascularized and rich in lymphoid tissue, which acts as a gateway for these agents. This is one reason why the risk of HIV transmission, for example, can be significantly higher in anal relations. Compared to vaginal ones, the virus exploits the high concentration of cells in lymphoid tissue to spread more efficiently. For this reason, safe practices like using condoms and lubricants are essential to reduce these risks. It's important to understand that pleasure should never come at the expense of health. Being informed about the vulnerabilities of this practice helps in making conscious and protected decisions. Third risk: higher chance of bacterial infections. The anal region, as the final stage of the digestive tract, naturally harbours very IOUs bacteria that make up the intestinal flora. These bacteria in their home generally don't cause problems, but they can become troublesome when they migrate to other areas, such as the urethra, vagina, or even the mouth. To better understand, think of these bacteria as noisy guests, as long as they stay where they belong. They coexist well with the environment, but if they end up in places where they're not welcome, they can cause problems. This bacterial mess can lead to conditions like urinary tract infections, balanitis, urethritis, or, in women, pelvic inflammatory diseases, which can result in pain and more serious complications. This situation requires attention because neglecting basic hygiene or failing to use condoms makes the transfer of these bacteria almost inevitable. This reinforces the importance of proper hygiene and adopting protective methods. It's not just about avoiding discomfort, but preserving long-term health awareness. And care are the greatest allies here. Fourth risk: problems with bowel control, although less common. Frequent anal S3X can overload the anal sphincter, the muscular structure that functions as a valve to control the passage of stool. If this region experiences frequent injuries, it can lose part of its ability to maintain control, leading to episodes of fecal incontinence. Imagine the sphincter as a barrier that needs to be strong and flexible to perform its job properly. If it is repeatedly pressured or injured, it may weaken over time. This can result in difficulties holding stool, affecting not only physical health, but also emotional and social well-being. No one wants to face embarrassing situations that could have been avoided to protect this region. It's crucial to respect the body's limits and avoid practices that could cause permanent damage. And if symptoms like difficulty controlling bowel movements occur, seeking medical advice is essential. Anal health, like that of any other part of the body, deserves special attention and care to ensure a more comfortable and peaceful life. Fifth risk: worsening of conditions like hemorrhoids. Hemorrhoids, which are simply dilated veins in the anal or rectal area, can already be a nuisance for many people. Now imagine this area being subjected to additional pressure or repeated small traumas. It's easy to see how anal practices can worsen an existing condition or even promote the appearance of these swollen veins. Think of the anal region as a road with heavy traffic. If the flow increases or small accidents occur along the way, the situation worsens. The extra friction and pressure can impair local circulation, making it easier for hemorrhoids to develop or worsen. And as those who have experienced them know, they can bring considerable discomfort, such as pain, itching, and even bleeding. That's why taking care of the health of this region is so important. Respecting the body's limits, using proper lubricants, and avoiding unnecessary strain are essential steps to minimize risks. After all, no one wants to turn a moment of pleasure into something that causes lasting discomfort. Throughout this video, we've discussed the necessary precautions to ensure that intimacy is not only pleasurable, but also safe for both partners. We explored the risks associated with anal S3X, such as injuries, infections, and other issues that can arise without proper care. Now, I'd like to know which of the risks presented do you think is most important to discuss in more depth? Share your opinion in the comments. It helps enrich the conversation if this video provided you with valuable information like it. Now, your support is essential to help this content reach more people and motivate us to continue addressing such important topics. Don't forget to subscribe to the channel and activate the notification bell. To stay updated, we're here to help you live a healthier and more informed life. See you in the next video.